Are you perplexed with a normal looking MRI and yet patient having severe back pain and sciatica? I'm here to explain the possible reasons for that. When the disc is bulging, even a 1 millimeter bulge can sometimes disturb the synovertebral nerve which is surrounding the periphery of the disc. The periphery of the disc, the annulus fibrosus, is guarded by synovertebral nerve. In some body types, even a slight bulge of the disc can irritate the nerve which produces a low back pain. Oftentimes we believe that such bulge is a normal age related change, but for this individual this slight bulge also has managed to produce the irritation of the synovertebral nerve. So when the nerve is irritated, it always complains in the form of low back pain. Secondly, a small annular tear will pave way for the nucleus to come out and slightly breach the boundary of its own containment. Remember, the nucleus pulposus is highly pro-inflammatory. The moment the nucleus comes out to the periphery of the annulus, the body will consider that as a threat and there will be a severe inflammation happening around the area. Such inflammation are so subtle that it cannot be picked up in the MRI yet, and the patient will still have inflammatory pain which won't be reported in the MRI. When it comes to disc related pain, some pains are purely mechanical. That means when you see the MRI, there will be a bulging of the disc posteriorly which causes mechanical compression of the nerve producing the pain, that is mechanical. In some cases the bulge will be very tiny or insignificant and yet it causes tremendous inflammation. We call that as an inflammatory pain. So human beings who have back pain will have varied proportional combinations of this inflammation and mechanical. So each and every patient is different here. Some will very well respond better with exercises, some will not respond with exercise because they fall under the inflammatory category, and such inflammations cannot be picked up in the MRI. Lastly and more importantly, all the MRIs in our country are done in supine position until the patient is opting for standing MRI. So in the supine position, your biomechanics is different. You are unloading the spine. There is no weight transmitted through the spine, unlike when you are in sitting, when you are traveling, when you are doing normal cooking or household chores. That's when the actual bulge will reveal itself. When you are lying supine, the disc is not loaded, so it won't reveal its bulge or its pathology as easily as it will be when you are bending forward or sitting for a long time in front of the computer. So these are all the functional positions that causes the pathology in the disc. It's not the resting position that causes pathology in the disc. The real representation of the disc pathology should be seen only if these MRIs are taken in a functional position, which is not feasible at this point of time. I'm sure in the future, after 4-5 years, technology will improve for us to get to know what is the extent of disc bulge or herniation when the patient is in the functional position. So in the nutshell, MRI is useful, but MRI doesn't say the entire story. Some MRIs are normal looking MRIs, yet the patient can have the symptom. Some MRIs are pathetically looking, yet the patient may not have any symptom. And that is the spectrum of back pain, and we need to know how to subclassify the patient so that we give an individualized program for each and every patient.